Health education and community pharmacy. Communicable diseases. In these diseases, the causative organism may pass or carried from person directly or indirectly. Diseases affecting respiratory tract. 1. Chickenpox. It is caused by virus called varicella zoster, VZ virus, or human alpha herpes virus 3. Mode of transmission. 1. By droplet infection and droplet nuclei. 2. Contamination from the discharge from ruptured lesion of skin. 3. Placental transfer of virus can occur in the fetus. Symptoms. Fever, malaise, aches, appearance of the rash in the form of crops on the trunk, face and the limbs. Within 24 hours the lesions become pustular, filled with pus. Pustules dry up in few days to form scabs. Incubation period. 14-16 days. Prevention and control. A. Consult the medical officer. B. Isolation of the patient to a separate room. C. Disinfection of articles used by patients. D. No specific treatment. Varicella zoster immunoglobulin, VZIG, and zoster immune plasma, ZIP, are used for passive immunization against chickenpox. Though. Measles. It is highly infectious disease caused by RNA paramyxovirus commonly called rubeola virus, primarily affecting children. Mode of transmission. 1. Direct contact through droplet infection such as sneezing, coughing, talking, kissing etc. From 4 days before onset of rash until 5 days thereafter. Though. Indirectly through fomites. Symptoms. Fever, coughing, sneezing, redness of the eyes, nasal catarrh, hoarse voice. Koplik spot inside the cheek around the opening of parotid glands, maculopapular rashes. These rashes subside within 5 to 7 days, leaving a brownish pigmentation. Incubation period. Thus -14 days. Prevention and control. A. Isolation of patients. Though. Disinfection of nose and throat discharges. 3. Active immunization as a single dose of 0.5 ml SC in children of no-12 months of age. 3. Infant.za, flu. It is highly communicable disease of respiratory tract. It is caused by influenza viruses A, B and C, orthomyxovirus. It may attack persons of all ages and occurs in epidemics. Mode of transmission. 1. Directly by droplet infection or droplet nuclei, through nasal epidemics. Discharge and sputum of patient. Though. Fomites. Incubation period. 1 or 2 days. Symptoms. Fever, chills, headache, malaise, backache, pain in the limbs, nausea, vomiting. Inflammation of the respiratory tract, cough. Complications include tracheitis, bronchitis, bronchiolitis and bronchopneumonia. Prevention and control. A. Early detection of cases. Though. Bed rest until fever subsides. 3. By giving a mild analgesic antipyretic like paracetamol 0.5-1 g every 4-6 hours. B. Antitussive like folcodeine 5-10 mg 3-4 times daily to suppress unproductive cough. 4. By prophylactic immunization using single dose of killed chick embryo vaccine in aqueous or saline suspension 0.5 ml SC5. Treatment by antivirals like amantadine and rimatidine in a dose of 100 mg twice a day for 3 to 5 days. Chair. Health education to the public about health concept and prevention from communicable disease. 4. Diphtheria. Diphtheria is an acute infectious disease of the upper respiratory tract caused by the toxigenic gram-positive Bacillus cornbacterium diphtheria. It is a common disease among children under age of 10. Sore throat is the most common presenting feature. It affects mouth, pharynx, nose or larynx. Diagnostic feature is the wash leather, elevated grayish-green membrane on the tonsil, surrounded by a zone of inflammation. Other features are husky voice, tachycardia and suffocation. Mode of transmission. Disease spreads from person to person by 1. Droplet infection through coughing, sneezing etc. Though. Indirectly through fomites infected by nasopharyngeal secretions, e.g., spoons, cups, toys, thermometers etc. Incubation period 2 to 4 days. Prevention and control. 1. Early detection of cases and carriers and their treatment. 2. Isolation of patients. 3. Active immunization with combined vaccine called DPT vaccine. DPT is given IM in 3 doses of 0.5 ml each at the age of 1/2 months, 2/2 months and 3/2 months. Thereafter, a first booster dose of 0.5 ml of DPT is given IM at the age of 18 months to 2 years. Thereafter, a second booster dose is given of DT vaccine 0.5 ml at the age
of 5 years. For the specific treatment of diphtheria, the diphtheria antitoxin prepared in horse serum is given in a dose of 10,000 to 30,000 units IM or 40,000 to 100,000 units intravenously in 2 divided doses at an interval of 2 hours. 5. Whooping cough, pertussis. Whooping cough is an acute infection of respiratory tract common among children under 5 years of age. It is caused by Bordetella pertussis. Mode of transmission, 1. Mainly by droplet infection and direct contact, during talking, coughing, sneezing. Incubation period, 7 to 14 days. Symptoms: severe attacks of an irritating cough. Paroxysmal attacks of cough are more severe in night. During these paroxysms, the face becomes cyanosed and the tongue may be injured. Complications include bronchitis, bronchopneumonia, convulsions, ulceration of frenum. Prevention and control. 1. Early diagnosis of cases. 2. Isolation of the patient. 3. Treatment and disinfection of nasopharyngeal discharges of infected patient. 4. Treatment with erythromycin, ampicillin and cotrimoxazole. 5. Active immunization with DPT vaccine, pertussis vaccine. 6. Tuberculosis. Human tuberculosis is a chronic disease caused by Mycobacterium tuberculosis, a non-motile slow-growing, non-spore-forming aerobic bacillus. Lung is the most common site of infection, although other areas like bones, meninges, joints, peritoneum, genitourinary tract and skin may also get infected. The disease is more prevalent in overcrowded towns and cities. Mode of transmission, 1. Mainly by droplet infection and droplet nuclei produced by the sputum of infected patients. Coughing results in large number of droplets, carrying viable organisms. Symptoms: acute febrile illness associated with respiratory catarrh, hemoptysis, pleurisy. Loss of weight, fatigue, anorexia, hearty cough, chest pain. Incubation period, 4 to 6 weeks. Prevention and control. 1. Early detection by examination of sputum, chest X-rays and tuberculin testing. 2. Isolation of infected persons and treatment in hospitals or sanatoriums specially made for TB patients. 3. Disinfection of handkerchiefs used for nasal discharges by burning. 4. Chemoprophylaxis by isoniazid alone for 1 year or INH along with ethambutol and pyrazinamide for 9 months. For the first 2 months, ethambutol 1 gmod INH 300 mgod. Rifampicin 450 mgod. Pyrazinamide 1.5 gmod.
For next 6 months, INH 300 mgod. Thiacetazone 150 mgod. 5. Chemotherapy by following drug regimen for 8 months. 6. BGG vaccination at the time of birth, till the age of 20 by intradermal injection 0.05 ml or 0.1 ml. Disease affecting intestinal tract. Typhoid, enteric fever. The term enteric fever is used for both typhoid and paratyphoid fever. Typhoid is caused by Salmonella typhi and is an acute communicable disease. Paratyphoid is caused by Salmonella paratyphi A and B mode of transmission. 1. Transmitted by fecal oral route or urine oral route. 2. Contaminated food, water, milk, hands or fingers. 3. Through flies. Incubation period, 7 to 28 days. Symptoms: prolonged fever, relative bradycardia, with involvement of lymphoid tissue, and constitutional disturbances. Prevention and control. 1. Isolation of the patient. Though. Disinfection of stools, urine, sputum by carbolic acid. Bedding, clothing and fomites must be disinfected with steam. 3. Provision of safe drinking water, proper disposal of excreta, pasteurization of milk, flies control. 4. Immunization of contacts with anti-typhoid vaccine. 5. Chemotherapy. Chloramphenicol is the drug of choice. 6. Health education of public regarding food and personal hygiene and treatment. Viral infections. 8. Poliomyelitis. Poliomyelitis is an acute viral infection caused by poliovirus having 3 serotypes 1, 2 and 3. Mode of transmission. 1. Fecal oral is the main route of transmission. Though. Contaminated food, water, milk, flies, hands or fingers. 3. Droplet infection. Symptoms. Fever, sore throat, headache, vomiting, involvement of CNS, stiffness of the neck and back, meningeal irritation and paralysis of variable extent may occur. Prevention and control. 8. By active immunization of all the infants and children using oral polio vaccine, OPV. 2 drops of OPV are given orally generally with each dose of DPT vaccine at the age of 1/2 months, 22 months, 312 months. The booster dose is given in the same dose at the age of 18 to 24 months. Though. Proper disposal of urine and feces. 3. Improvement of the personal hygiene. 4. Health education of the community. Though. Hepatitis. Viral hepatitis is caused by 2 types of viruses. A. Hepatitis A virus, HAV. B. Hepatitis B virus, HBV. Hepatitis A. The disease is most common among children and adults. Causative agent for hepatitis A is an enterovirus hepatitis A virus. It multiplies in hepatocytes and is characterized by fever, chills, headache, fatigue, generalized weakness and pain followed by anorexia, nausea, vomiting, dark urine and jaundice. Mode of transmission. 1. Fecal oral route. It spreads through contaminated water, milk or food or directly from person to person. Though. Parenteral route. Through needle, biod or blood products. But is rare. 3. Sexual transmission. Occur mainly among homosexual men. Incubation period. 15 to 45 days, usually 28 days. Prevention and control. 8. Isolation of cases. Though. Disinfection of feces and fomites. 3. Providing safe water supply, sanitary disposal of human excreta, adopting anti-fly measures etc. 4. Promoting simple measures of personal hygiene such as hand washing after toilet or before meals. 5. Proper sterilization of needles and syringes. 6. By giving human normal immunoglobulin to all contacts before or within a week of exposure by intramuscular route. Hepatitis B. The causative agent is hepatitis B virus, HBV. This is also called serum hepatitis. It is a major systemic infection with major pathology in the liver. Mode of transmission. 1. Parenteral route. A. Through blood transfusion, inadequately sterilized syringes and needles, ear piercing and sexual contact. B. Transmission from HPV carrier mothers to their babies, i.e., from infected mother to fetus in utero. C. Infection may be transmitted by kissing. D. Body secretions such as saliva and semen are also infective. Incubation period. 60 to 80 days. Prevention and control. I. Active immunization with hepatitis B vaccine in 3 doses of 1 ml each. The first doses at the interval of 1 month and third dose 6 months after first dose. Though. The hepatitis B immunoglobulin, HBIG, should be given immediately after accidental inoculation, ideally within 6 to 48 hours. 3. Screening of Block D donors for HBV infection. 4. Proper sterilization of needles and syringes. 5. Providing health education to community. Hookworm infections. There are 2 varieties of hookworms which cause the infection. I. Ancylostoma duodenal. E. Nicata americanus. Mode of transmission. The adult hookworm is a grayish-white nematode, 1 cm in length, found attached to the mucosa of the small intestine, particularly of the jejunum. Hookworm eggs are passed in the feces, where they are converted into larvae and stay alive in the moisture for about 2 months. These larvae enter human beings through hair follicles, sweat glands into the epidermis. After infecting the skin, they cause dermatitis and enter lymphatics or veins and reach blood. They are then carried to lungs. After entering the alveoli, they ascend the bronchi, are swallowed and grow in the small intestine, reaching maturity in 4-7 weeks after infection. Hemorrhage in duodenum and jejunum gives rise to anemia. Ankylostoma larvae can enter directly into the intestine by ingestion of fruits and vegetables contaminated by them. Symptoms: dermatitis at the time of infection, paroxysmal cough and blood-stained sputum. Vomiting, epigastric pain, loose stools, iron deficiency, anemia. Prevention and control. Ache. Proper sanitary disposal of feces. Though. Avoid raw eating of unwashed vegetables, arid fruits. 3. Personal hygiene should be adopted, avoiding barefoot walking. 4. Treatment of infected persons by chemotherapy. Mebendazole is the drug of choice. 100 mg orally t.i.d. for 3 days. Other drugs which can be used are albendazole, pyrantel. 5. Treatment of anemia by giving ferrous sulfate 200 mg orally 3 times a day for 3 months. 6. By giving health education. Anthropod borne infection. Ache. Plague. This is highly fatal infectious disease transmitted from vertebrate animals to men under natural conditions. It is caused by Yersinia sociotuberculosis pestis. It is primarily a disease of rodents and vertebrate animals. Man is affected incidentally. Vector of plague is rat flea, Xenopsilla. Plague occurs in man in 3 forms: bubonic, pneumonic and septicemic forms. Bubonic plague is the most common type. Mode of transmission: 1. By the bite of infected rat fleas. Though plague infection may also occur by direct contact with the tissues of an infected animal. 3. Pneumonic plague spread directly from person to person by droplet infection. Symptoms: bubonic plague. In this, lymph glands are affected and buboes are formed on neck, axilla and groins. Pneumonic plague. It is conveyed by droplet infection during coughing, sneezing, etc. Septicemic plague. In this, blood is infected without the formation of buboes. Prevention and control. Ache. Early diagnosis and prompt notification to health authorities. Though. Isolation and disinfection of patient's sputum and treatment. 3. Mass destruction of rodents by using rodenticides like zinc sulfate and barium carbonate. 4. Control of fleas by destruction and spray of DDT and BHC. 5. Immunization with plague vaccine containing formalin-killed plague bacilli, subcutaneously in 2 doses of 0.5 and 1.0 ml at 1 to 2 weeks interval. 6. Chemoprophylaxis with tetracycline. 7. Treatment with tetracycline 500 mg 6 hourly for 10 days. 8. By giving health education. Though. Malaria. Malaria is caused by parasites of the genus Plasmodium, i.e. Plasmodium falciparum, P. vax, P. ovale and P. malariae. It is transmitted to man by the bite of infected female Anopheles mosquito. It may also be transmitted by blood transfusion or inoculation. It is a disease of hot, wet climates. Malaria due to P. falciparum is more severe than due to the other sensitive parasites. Life cycle of malarial parasite: asexual phase or schizogony. The female Anopheles mosquito becomes infected when it sucks the human blood containing gametocyte, the sexual forms of malarial parasite. The infected mosquito inoculates sporozoites into the human blood, which disappear within 30 minutes from the blood and enter the liver. After some days, merozoites leave the liver and enter RBC, where further multiplication takes place, producing senescence. Rupture of senescence releases more merozoites into blood and causes fever. Malaria is always accompanied by hemolysis, and following a severe or prolonged attack, anemia may be severe. Though. Sexual cycle. Some of the young trophozoites grow into male and female form called gametocytes. Male and female gametes unite to form zygote, which grows in the stomach of Anopheles into oocyst, which after rupturing release number of sporozoites into the body cavity of insect. Then they enter into the salivary glands, from where it is transferred to healthy person by the mosquito bite. Symptoms: fever along with the chill, profuse perspiration, enlarged liver and spleen. Headache and anemia. Prevention and control. Ache. Early detection and notification to health authorities. Though. Chemotherapy using chloroquine or quinine or other suitable drug. 3. Breeding of mosquitoes must be checked and destruction of mosquito larvae by spraying DDT. Gamexane insecticides, using antilarval measures like using kerosene oil along with pine oil, using gambusha fishes in standing water. 4. Protection against mosquito bites by using mosquito nets, non-corrosive wire-netted doors and windows in the houses, mosquito repellent creams, burning of pyrethrum-based mosquito coils. 5. Health education of the public regarding importance of proper drainage and sanitary measures, receiving treatment for malaria. 6. Chemoprophylaxis by drugs such as progvanil, pyrimethamine etc. 3. Filariasis. Filariasis is caused due to the infection with the filarial worm Wucheria hancrofti and W. malayi. The parasite complete their life cycle in two sets of hosts, i.e., man and mosquito, Culex fatigans. The adult worms live in the lymphatics and the females produce microfilaria which at night circulate in large numbers in the peripheral blood from lungs. The mosquito sucks the blood of infected person at night. Elephantiasis or filariasis develops when embryos get accumulated in lymph vessels and glands. Incubation period is not less than 3 months. Course of inflamed lymphatic vessels, inflammation of spermatic cord, epididymitis, temporary edema, increase in scrotum size. Prevention and control. Ache. Protection from mosquito bite by using mosquito nets, repellent creams. Though. Prevention of mosquito breeding by spraying insecticides, proper sanitary disposal of wastes, by adopting antilarval measures. 3. Early detection and treatment with heterozan, diethyl carbamazine. 4. Periodic blood examination. 5. Health education to the public. Surface infections. Ache. Rabies. Rabies is 100% fatal infectious disease. Rabies is also known as hydrophobia and is primarily a disease of warm-blooded animals such as dogs, cats, wolves, jackals, monkeys. The causative agent is rhabdovirus, which infects the central nervous tissue and salivary glands of mammals and is usually conveyed by saliva through bites or licks on abrasions or on intact mucous membranes. Symptoms: hydrophobia, running saliva, increased temperature, delusions, hallucinations. Mania and death within 2-4 days. Prevention and control. 1. The wound caused by the bite must be washed with strong soap and water thoroughly. It is then treated with strong antiseptic and then dressing or bandage is applied. Though. Observe the biting animal for 10 days. If the animal dies within 10 days, anti-rabies treatment should be started immediately. 3. Anti-rabies vaccine is given either intramuscularly or intradermally. 4. For controlling rabies, precautions should be taken such as a. Destruction of stray dogs. B. Licensing and vaccination of all domestic dog. C. Monitoring of reservoir hosts. D. Control and quarantine of imported animals. A. Vaccination of risk animals and man. Though. Trachoma. Trachoma is an eye disease, quite common in India. Trachoma is a chronic communicable keratoconjunctivitis and is an important cause of blindness in the world. Causative agent. It is caused by Chlamydia trachomatis. Mode of transmission. 1. It spreads by direct or indirect contact with ocular discharges of infected persons. Though. Contact with infected towels, fingers, clothings, handkerchief etc. Symptoms. It is an inflammatory disease of the eye, affecting conjunctiva and cornea. Virus infects mucous membrane of eyeball and lining of eyelids. Early symptoms include conjunctival irritation and blepharospasm, but the problem may not be detected until vision appears to fall. The infection may disappear spontaneously or may progress in the form of conjunctival scarring, inward deviation of eyelashes or the laid margin leading to corneal ulceration. Incubation period 5-12 days. Prevention and control. Maintaining personal hygiene. Though avoiding contact with the infected persons. 3. Assessment of the problem, its causes etc. 4. Chemotherapy. 1% ointment of tetracycline twice daily is the drug of choice. Erythromycin, rifampicin, chloramphenicol are other drugs. 5. Surgical treatment to prevent blindness. 6. Health education about use of antibiotic, importance of personal hygiene. 7. Hygiene of the community. 3. Tetanus. Causative agent is exotoxin by Clostridium tetani, GM jodhve spore-bearing bacteria. Exotoxin of the organism is called tetanospasmin. The spores germinate under anaerobic conditions and produce exotoxin. Mode of transmission 1. By contamination of wounds with tetanus spores present in soil or dust from horse dung. Though injuries due to the abrasion, puncture wound, burns, human bite, animal bite, stings, after unsterile injections, vaccinations. 3. May result from surgery called post-operative tetanus. Incubation period 6 to 10 days. Prevention and control. By giving active immunization. Active immunization with tetanus toxoid, 2 doses 0.5 ml IM at intervals of 1 to 2 months. Infants and children are best immunized by giving DPT vaccine and DT vaccines. Active immunization during pregnancy also prevents tetanus in the neonates. 2 doses of tetanus toxoid each of 0.5 ml at an interval of 1 to 2 months is given. Passive immunization. For this purpose, injection of human tetanus immunoglobulin or ATS, antitetanus serum, is given just after the injury to provide protection for 1 month. 4. Leprosy. Leprosy is a chronic communicable disease caused by Mycobacterium leprae. Mode of transmission 1. Droplet infection mainly. 2. Direct contact with the infectious patient. 3. By indirect contacts with fomites such as contaminated clothes. 4. It may also be transmitted from breast milk of the infected mother to their infants. Symptoms. The disease mainly affects peripheral nerves and cause irreversible damage. It is characterized by 1. Hypopigmented patches over the skin. Though partial or total loss of cutaneous sensation in the affected area. 3. Thickening of the nerves. 4. Presence of acid-fast bacilli in the skin or nasal smear. Prevention and control. Early detection of all cases in the community by contact survey, group survey or mass surveys. B. Isolation of infected persons in hospitals or leper homes.